Good evening. My name is Melanie Robertson and I'm the Acting CEO at Ballarat Health Services. At Ballarat Health Services and within the Ballarat community, we acknowledge the traditional custodians of the land and waters on which we meet this evening. For me, that's the Wathaurong people of the Kulin Nation, whose culture and customs have nurtured and continue to nurture this land since dream time. We pay respects to elders past, present and future and express our gratitude to all that we can for sharing this land with them today. Firstly, thank you so very much for coming along this evening. It's truly appreciated in our efforts as a community to suppress COVID in Ballarat, but throughout our state and our country. I also want to acknowledge the enormous amount of work that's actually occurring right now in our community. And we certainly understand that this is an incredibly challenging time for everyone in our community. We have an amazing, knowledgeable and united team working together to tackle the situation that currently exists in Ballarat. The resources and efforts put in by everyone is immense. The priority of Ballarat Health Services is to provide not only a wonderful health service to our community, but provide information. And this forum is doing exactly that. We want to provide a forum for which we answer the questions that you have as our community. This evening we'll hear from leaders in our COVID response, and we'll have the opportunity to ask questions at the end. And we certainly ask you to put them into the chat. We'll respond to them either tonight verbally, or that we will continue to express them out in our social media and on Facebook. We certainly apologise that this evening we've been unable to provide an Auslan interpreter, but we are recording tonight's forum and that will be provided on YouTube with closed captions. This evening we'll hear from Jeroen Weimar, the COVID-19 Response Commander, Associate Professor Rosemary Aldrich, the Medical Director of the Grampians Public Health Unit, Evan King, the CEO from the City of Ballarat, and Mayor Daniel Moloney. Thank you once again for attending tonight, and we hope this is a forum which you gain much information and we can tackle this together. I will introduce Jeroen as our very first speaker. It's a voice that we hear constantly, telling us the news and updating us on a regular basis. We certainly thank him for his time tonight, and welcome to Ballarat, Jeroen.
Good evening. Thank you, Melanie, and thank you to everybody who's joined us here tonight. I'd also like to acknowledge the lands on which we meet today and pay my respects to elders past, present and emerging. Look, firstly, let me thank the entire community of Ballarat for the most phenomenal response over the last 2 or 3 days as we've been grappling with a number of positive COVID cases in your community. It's been, I know it's always a chilling thought, when particularly as we started to ease restrictions in regional Victoria, to see that COVID is still alive and well and causing challenges for us within Ballarat. The situation at the moment is that we have, as at this morning at least, 9 active cases of COVID in the community over 3 separate households. First of all, I'm pleased to confirm that I think at the moment all those 9 individuals are otherwise well. They're isolating safely and being supported to isolate safely by a range of organisations and agencies. And my thanks to them above all for doing the right thing, for getting tested early and for isolating and therefore minimising the onward spread from here on in. Of course, we're now looking for any other signs of COVID transmission in Ballarat. And over the last 3 days, we've tested literally thousands of people. I think over 2,000 yesterday, over 1,000 the day before. I suspect again another big number today. And that is all helping us to understand and identify whether there are any other positive cases that may be lurking, but also to ensure that we can get medical support and help to people who are positive with COVID, and of course make sure they minimise the risk of passing it on to other people. To help with that testing programme, we've set up a large number of additional sites, and my thanks particularly to Ballarat Health and to the City of Greater Ballarat for the fantastic work over the last few days in getting these additional sites up and running and just creating the energy around getting tested at this particular time. The leading areas for investigation for us at the moment are of course to understand if there is any other positive cases, either amongst the primary close contacts of people who know the 9 active cases and who may have been in contact with them, or around any of those exposure sites. Today we have around 200 primary close contacts of people that we know about who are isolating because they are closely associated with the positive cases, and we'll be getting test results for them We had about 2/3 of the test results back this morning. Those are all negative for those 200 people. I'm expecting to see the remaining test results over the next day or so. We also have around 30 different exposure sites across Ballarat, across Delacombe and across Sebastopol. I'd really encourage you to check the Department of Health website. We list all of the exposure sites on there in Ballarat, in fact, across the whole state. And if you've been to those exposure sites, it's really important to come forward and get tested quickly so we can establish whether you've been infected at that point in time, and that we can help you to support and to isolate. We, of course, are also watching very closely things like wastewater detect, and one of the reasons why why the Chief Health Officer has decided to lock down Ballarat for 7 days is because we've seen a number of positive detects in different wastewater catchments across the wider city of Ballarat, and that's what's made us concerned about possible movement of the virus in our community. So again, we'll watch that very closely over the next few days and try to associate that with any positive cases that we identify. Finally, can I just thank again all the partners that we're working with. The real effort is being led by the Grampians Public Health Unit, and we'll hear from Rosemary in a moment. They've been phenomenal partners in really leading the charge against COVID in Ballarat and the wider Grampians region, and we're very grateful to them and the deep professionalism and expertise that they bring to the party. Of course, Ballarat Health has continued to do all the hard yards, not only around the testing space, but of course also the vaccination program and making sure that we provide good access to vaccination for everybody in Ballarat continue to do that over the weeks ahead. Evan and Major Moloney from the City of Greater Ballarat, again, very active in this whole space, and it's been great to work with them and to meet with them on site a couple of days ago to get a sense of how we continue to work together to support the wider community. Over the next few days, I expect a lot more testing activity. I expect to see a lot more people getting tested and getting those test results, and we should have a pretty good idea, I think, by the end of the weekend around whether we're finding any other unexpected or mystery cases, or whether we're starting to see this outbreak being captured fairly early on. So a lot of work to do. My thanks again to the whole community for doing the right thing. So please, over the next few days, the most important thing is please stay within those rules, stay within those lockdown rules, only 5 reasons to leave your house, and please minimize the time you spend when you're shopping or when you're out and about, meeting with other people. Secondly, please get tested if you've got symptoms. Please get tested if you've been to those exposure sites. And if you're just generally concerned, then please come forward and get tested over the next few days. And finally, although it's wonderful to see that 7 out of 10 people in Ballarat have been vaccinated, there are some of you who have not yet been vaccinated. This is a really good time for people to really start to prioritise their vaccination appointments. So please book in your vaccination appointment, your first dose if you haven't had it yet, or start to think about your second dose at that right time interval. With that, I'll look forward to the wider conversation and hand back to Melanie.
Thank you. Thank you so very much. It's incredibly important that we provide accurate and timely information to our community. And we certainly thank you, daily for the information that you're able to provide to the wider community. I am now going to ask Professor or Associate Professor Rosemary Aldrich, who's the Medical Director of the Grampians Public Health Unit, to speak about our local response and also a little bit about what the Grampians Public Health Unit is and the incredibly important role that it plays protecting the health of Ballarat and the wider Grampians community. Thanks, Rosemary.
Thanks very much, Mel. Thank you for those kind words, Jeroen. We're a group of people who, for those of us who live in Ballarat, love our city, and we work very hard to support the city because this is our city, and we join with all of our civic leaders and other professionals in our city, as well as our most important partners who, of course, are the residents of our city, to keep our city safe. And just as Jeroen has said, we've had people come out in large numbers. I think the last time I looked at the test tracker that is on the City of Ballarat's website, I think we had 2,500 tests already today. So that is a testament to the strength of this community, that when we ask the community to reflect on how we can keep ourselves safe, our community listens to our messages and comes out and responds. So I think that's a great strength. And it's that strength which will continue to work in the favour, and as Jeroen has said, to hopefully stop this before it starts, stop it before it takes hold, because of the bold actions, but also the evidence-informed actions that were taken of the Chief Health Officer's decision to have us locked down. That gives us a chance to ensure that people are staying where they are, and essentially gives us the chance to do those essential functions of the public health unit while the civic leaders, the health services together, and indeed, as I have said, the residents of our community, ensuring that the needs of our community are met. We're very grateful to the state and the support we're getting, of course, from the state mechanisms of the state of Victoria in setting up numerous testing sites, as you know, in absolute record time. I'm sure it must be in a blink of an eye. We saw early morning yesterday as the dawn was breaking, there were sites being set up, and indeed we're ready to go. So I think all of us in Ballarat are very grateful to the support that's been given to us. I thought I might just spend a little bit of time talking about what a public health unit does. And essentially, it's self-explanatory that the public health unit there is to support all of the other mechanisms of our city to keep the public safe and to actually preserve that health, to protect the health of our public. And we do that in quite a simple way, which is especially when we're looking at a condition like COVID, so a communicable condition, but a condition like COVID, which we know will get ahead of us unless we try and keep ahead of it. We have a few things that we do. First of all, as you would have seen from over this past week, we had the wastewater detections, and based on the wastewater detections we have a group of the people who are helping keep this city safe. So from City of Ballarat, the Health Services, the Public Health Unit, Community Health, Central Highlands Water, Vic Pol, all sorts of agencies have been coming together in this city since April last year and planning for eventualities, but also planning for how we would respond in a situation like this. And you saw that last year when we did have our numbers of cases last year. And of course, we've been continuing to plan for that. And so when we saw those wastewater detections coming with no evidence of any cases at all, we met and we had news on last Friday night that we had a case in Dalesford unrelated to our wastewater detections, but we met on the Saturday morning and we decided, given the evidence of the wastewater detections that were being reported and that we were hearing about, that something was brewing. And so we thought we would try and think ahead. To get ahead, we had to think ahead. So that meant we, as you may know, we set up our Mighty Bush site for testing on the Sunday afternoon. It continued on the Monday afternoon, and not unexpectedly, with the media we had asking people to come out and get tested, we had our first case on Monday night. And had we not done that, we might have not had the news about that, and it's possible that that case might have been in the community for longer. They weren't. They actually got tested pretty soon after they got their first symptoms, and their whole household shut down, which was great. So part of the strength of this is that when we identify a case, we then go through a process where we identify a case, we talk to the person, and in talking to the person, of course, we try and find out how they might have acquired their COVID, and then we ask how they are, and before going too far, we make sure that as soon as we can, we refer them into whatever care team they need to be part of. Jeroen had talked about that. But part of talking to the case is another strategy to contain around the case the COVID that might be there. And by doing that, we ask about not only how they might have caught their COVID, but also where they've been while infectious. So who's in their household, who they might have come into contact with through work or through education or through childcare or social contacts or by seeking healthcare or meeting appointments or something like that. We'll find all that out. And that's how we think about and generate our exposure sites. And of course, through our exposure site information, by understanding where a person has been, that then helps us identify who might be at risk from having had contact with that case. And so we commence our contact tracing process. Now, contact tracing is only as good as the people we know about, or indeed in this situation, the people who come out for testing. And it's that, and by contacting, by testing, by tracing and isolating, we can contain those rings of risk around a case. And in fact, we're right in the middle, and certainly having had these cases eventuate over the course of the week, just as you would expect the public health unit to be doing, that's what we've been doing. So we've identified a case, we've made sure they're getting the care they need, we've tried to identify where they've been to contain the risk around that case, and that identifies to us who the contacts are that they have that we need to be tracing, and what the sites are that we need to be putting warnings about. And that's where we get our tier 1 and our tier 2 warnings from. So we have the case, the care, the contact, the contain, and then of course, fundamental to this is communication. And that's one of the reasons why you've seen Mel and myself giving press interviews, giving radio interviews as we've done this week. There's stories about us about the effort in the media And this is why we're here tonight. So I might leave that there, Mel. Obviously, we can answer questions, but that's just a little bit of a background about how we got to where we are and what we do as a public health unit.
Thank you, Rosemary, and certainly thank you to you and your team for the incredible work that you do in protecting us. Your team of testers that are out there in, all day in Ballarat winters, and certainly we've been able to provide you a little bit more sunshine over the past few days. But certainly of your vaccinators who are working around the clock, and of contract tracers, their commitment to protecting Ballarat and the region is it's certainly plausible. Next, I'm going to throw to Evan King. Evan King is the CEO of the City of Ballarat, and we know that this is an incredibly challenging time on a number of fronts for everyone in the community. It's challenging from a health point of view, it's challenging from a social point of view, it's challenging from an economic point of view. But Evan and his team around him provide incredible care and support to our community, and I'd just like him to provide a little bit more information about the relief and support services that's occurring and is available to our community. Thank you, Evan.
Thanks, Melanie, for that. And can I just start off by thanking Melanie and the health services? Can I thank Rosemary and the public health unit, and Jeroen and his team, the rapid response, rapid testing, the speed in which it was set up is incredibly critical, because every minute somebody is out in the community that is positive creates an enormous amount of risk, and obviously creates a compounding effect of exposure sites. So can I just thank everyone involved for protecting our community? I think that's really important to acknowledge that. 1,000 tests on Wednesday, 2,000 tests on Thursday, and 2,500 tests today. That's just truly amazing. And can I thank the Ballarat community for recognising the importance of this. I know it can be frustrating queuing. I know it's not easy, but you're doing the right thing by your community to go and get tested, so we can find where this virus is in the city and we can stamp it out as soon as possible. 71% of our community has had one injection, and 46.9% of the community has had two injections. That also holds us in great stead, because obviously the greater the number of people that are vaccinated, the less likely this virus is to spread. So can I thank the community for, one, getting tested, and two, obviously for the great vaccination rates that we're starting to see, and can I encourage everyone to keep doing that. We've obviously been incredibly busy, involved in setting up rapid testing sites, managing traffic, getting messaging out, and really playing, I suppose, a collaborative role in bringing all of the services together to deliver this great protection for our community. The city's been working in bubbles for some time to make sure that if there was a breakout, that we wouldn't spread the virus throughout the organisation, and that we could continue to provide the much needed services that we provide to our community. We've particularly had our Meals on Wheels team operating out of 2 locations, and we've been ensuring that we've got a great supply of frozen meals should an outbreak occur, and should we have large volumes of people in isolation. The food bank has rolled into town. We've got an enormous amount of food relief coming into town. So we're really ready to be able to manage whatever comes of this outbreak at the moment. From a relief perspective, the best way, if anyone needs any form of relief, please ring the COVID hotline, 1800 675 398. That will be triaged through the Red Cross and through council, so that we can start looking at how we provide care packages and emergency relief packages for food. One of the things you find in a city that is so connected and so supportive, that many people find others that can drop off food and those sorts of things, but we know there are lots of vulnerable people out there, and there is support there. So please contact that number, and we can work out what support you need, what relief you need, and we can roll that out to anyone that needs it. Obviously, there's a range of financial support packages out there. There's the support packages around business, so business costs assistance program, licensed hospitality venue support, And council has its $1 million business and community support program, and we've already allocated out over $100,000 out of that support package. So the messaging is really get tested if you're showing any symptoms, get tested if you've been to tier 1 or tier 2 sites, keep booking and get your jabs, because that will be our ultimate solution in the end. And Ballarat, thank you. You are looking after yourselves and we're here to support you. Thanks, Mel.
Thank you, Evan. It's there's certainly results so far are promising with the number of tests that we're getting through, and we just need to keep going over the next few days, and hopefully we're in a position where we can get back to living a level of normality. So once again, thank you hugely to the Ballarat community. I'm absolutely delighted to see the questions rolling in, and I'm looking through them, and so we are getting them. Keep them coming through, and I will then facilitate a question answer, as I said earlier. So we will try and answer what we can verbally, but we will be using this as a basis of information that will continually go out to our community over the next few days, and we will certainly provide written responses via the Facebook page and through as many mechanisms as we possibly can. I certainly welcome our Mayor Daniel Moloney, to talk a little bit about, from his view, what's happening in the city at the moment. And I know that he's in isolation, and dealing with, no doubt, some of the consequences of, being in isolation and the frustrations and that it is for people. But, it's incredibly important, once again, all of this will quickly come undone if people don't do the right thing. And we're certainly counting on every citizen and every community member, not just in Ballarat, but the surrounding region as well, to do the right thing. So certainly welcome, Mayor Moloney. Thank you.
Thanks, Mel, and good day, everyone. Yes, as Mel said, it's interesting being in ISO myself after visiting the Forge for a few minutes on Saturday afternoon. But I only really sort of touch on that really to sort of, because it actually then highlights, I guess, the various experiences that many of us will be having across the city, either now or over the next few days. And so it's with gratitude, I guess, that I reach out to Melanie and Rosemary, everyone as part of our health services team across the region. You're doing an awesome job. Thank you to Jeroen and his team. If you could please pass on to the state government, we greatly appreciate that from the city's point of view. From a personal point of view, you see so many examples of people being wonderful, incredible people, and it reminds us of why we live in a city like Ballarat. Spending a couple of hours in the queue at the Skipton Street site the other day, someone, the lady tested me with it. You could tell she was at still a beautiful, fresh smile behind that mask. And she said, "I'm sorry, things are taking so long. This is my day off." And I thought, that's crikey. This is incredible that these people are giving so much of their time, just acting absolutely in the best interest of their city. I see that there are so many people who are helping others out and getting food supplies. I think I'm about my third different person. I'm bugging to go to the supermarket for me. And even our supermarket workers are incredibly run off their feet right now, trying to keep up, and many of them also finding themselves at different times into isolation. I want to also thank our various community organisations that are doing great work at the moment, such as Anglicare, Uniting Ballarat, Salvation Army, and St Vincent de Paul Society, doing a lot of work locally in addition to support our efforts. I want to thank, I've had support reach out from the mayors of all of our neighbouring cities as well too. Country people really do stick together, and to see such strong support coming through is great. As Evan said, we've learned a lot from the lessons of Shepparton. They're an equally awesome people who have banded together. They responded incredibly well to this, and we know that Ballarat will equally rise to the occasion. So continue, please, to get tested. I'm encouraged by those huge queues. I know it's not much fun waiting, but on the same token, the very fact that you're doing it means that we have a fighting chance to get on top of this. So fingers crossed for the days ahead. Hopefully this is a quick containment, but that'll only happen, I guess, if we all continue to do our part. So thank you, wonderful people, much appreciated. Let's get into some questions. Thanks, Mel.
Thanks, Mayor Moloney. What I'm going to do is read some of the questions out. I will direct them to one of our panel members, but I'll also ask people if they want to add any information in to jump in as well and make sure we press those unmute buttons, so which is often a bit tricky. So the very first question I'm going to direct it to Jeroen, and it's about restrictions easing. There was, some information that's come out recently about the current restrictions easing, I believe, as of tonight. And I was just wondering, are those restrictions easing for Ballarat as well, given that we're back into lockdown, and what are they, Jeroen?
Thanks, Mel. And yes, it's a very small glimmer of good news, but yes, the restrictions are easing a little bit in Ballarat and in Melbourne at midnight tonight. What it means is that you'll be able to, exercise for, I think, an hour longer. I think 3 hours of exercise now, go on the table in front of me. But I think the most important thing is you'll be able to, if you've been fully vaccinated, you'll be able to meet with up to 5 adults from 2 households can meet together outside. That's really what we found, particularly for those of us who have been in lockdown for a long time. It's that lack of social contact that's really hard. So from midnight tonight, you'll be able to go back to meeting outside, groups of 5 adults from 2 separate households. So we're trying to minimize household mixing. You can also bring your kids along. And again, please mask wearing and all those other things as per normal. That's really the major change. There are details on our website that will give you a bit more detail.
Fantastic. It's good to hear. We're happy with those little glimmers of change occurring. Next question, I'm going to look to Rosemary. It's about the Pfizer vaccines, and we have heard, well, you may have heard that Ballarat has been additional Pfizer doses being promised by the state government. The timeline, Rosemary, for the arrival of those Pfizer vaccine doses by the state government?
Thanks, Mel.
And what will it mean for Ballarat vaccination clinics?
Sure. So thank you for that, Mel. So essentially what we do is when we get doses, we pace ourselves with the use of those doses so that we know that we can plan for having a steady supply of doses. What this means is that because we know we're getting additional doses, we can ramp up with the doses we've already got. And so that means that by the time we get the other doses, we'll be able to have ramped up that increased demand. So we're opening up further appointments. We'll ramp up to 100% of the doses we can use. So please, this just reinforces the message that our strongest defence against COVID is vaccination. So if you're seeking to make an appointment, please do that, and we'll be able to accommodate those appointments as we get those increased doses. But we don't have to wait until we get the increased doses, because what we can do is doses we might have used over 2 weeks, we can concertina that into the earlier part of that 2 weeks, and we know we'll be getting the other doses so that we'll still be able to continue with that supply.
Next one is, what do I do if I get a text telling me I've been to an exposure site, but yet I can't find it on the website? I'm going to head back to Jeroen for that one.
Yeah, very simply, if you get a text from the department saying you've been to an exposure site, it'll usually tell you to go and get tested and then to isolate until you have a test result, or to get tested and isolate for 14 days. Depends on whether it was a tier 1 site or a tier 2 site. If you can't find the exposure site, and again, there's a good list on our website of exposure sites. There's also a map of exposure sites on our website, so you don't have to put in a suburb. If you keep scrolling down, there's a map there. You can zoom in and see all the exposure sites. We do have exposure sites that we don't list. So for example, quite often schools, childcare centres, because they have a defined group of people who can go into them, they don't, we contact those people directly through the school's registration systems, or if it's a private business where there are no external visitors, we will just contact people directly. It won't go on the exposure site list. So the exposure site map and listing is for the public to identify public places where they may have been. But again, if you're using your QR code, check in every time you go somewhere. And if you're getting those text messages, please follow those directions.
I'm going to head right back again to you, Jeroen. You're with another question, and to simply explain, what is the difference between a tier 1 and a tier 2 exposure site?
That's a great question. Actually, Rosemary could do this one probably better than me, but I'll give it a go and then Rosemary can correct me. So it really comes down to, it's a risk assessment that our public health teams make about the likelihood of there being significant exposure at that site. So it often depends on what the physical environment looks like. So if I take the Forge Pizzeria, it's a restaurant. People spend 2 or 3 hours in a restaurant. I think in this case, the positive case was there for a meal. They'll spend a good amount of time there. Lots of opportunities for contact, shared toilets, all those sort of things. So that will be a tier 1 site. A tier 2 site might be a servo. I go in, I'm positive. I go and pay for my fuel. I run out again. I was there for 5 minutes, 10 minutes. The chances of seeing anybody else is pretty light. It's a largely outdoor space. that might be a tier 2 site. So it's a very much a case by case. Sometimes, very rarely, we'll start off with somebody telling us, I was only somewhere for 5 minutes. We make it a tier 2 site. And then 2 days later, say, oh, actually, it turns out I was there for 2 hours. It then gets uplifted to a tier 1 site. So they do sometimes change, which causes a lot of confusion.
Wonderful.
Rosemary's got a better answer.
Rosemary?
No,
Or
I
you're
think that was,
satisfied?
I think that was a perfect answer, Jeroen. I thought that was a perfect answer, so thank you.
How do I find local exposure sites? So I will head to Rosemary for that one.
So as Jeroen has mentioned, they are listed on the Department of Health website by suburb, but I always find it's actually easier to scroll down and go to the map. And that way there's 2 things you can see. You'll see a red spot if it's a tier 1 site and a sort of light brown spot if it's a tier 2 site, and you'll see them all at once as well. So you can know where you are, and you may not know the suburb, you may not know the street, but you can see how close it is to where you are. And I think that's actually the best visual way to characterise and to understand where they are. And if you click on the spot, it'll tell you what the stratification is, but it will also tell you what to do.
Wonderful. Thanks, Rosemary. To Evan, how many COVID tests have been carried out in the city since yesterday? And what do I do if the queue is too long?
Yes, so thanks, Mel, for that. It's a great question. So there's been 2,500 tests today. So that's obviously in reflection to a ramp up in the number of test sites. There's a number of different type of test sites as well. So there's drive-in and there's walk-in sites. So you can go onto the Department of Health website, or you can go via the Ballarat Health Services website to find the various websites. It'll actually show you the sites where you can get tested. And if you click on them, it'll actually tell you what type of site it is, how long it is open for, and what the waiting time is. And I strongly recommend people that are going to go and get tested, go and have a look at that, because quite often you'll be able to find a queue that might be a bit shorter somewhere else and take a bit of pressure off those sites that are really experiencing some demand at the moment. We are finding the early morning crowd is obviously queuing up quite early, so there's quite a large quantity of people queuing early. I did a drive around to all of the testing sites today at 11:30, and the morning rush had sort of dropped off a bit at the moment. So get on, have a look, plan your day, and try and find the easiest way. And we really just ask everyone to be patient. We understand it can be frustrating sitting in the queue. We know you're there, you're doing the right thing. Bring some board games, bring some food, and just get ready to just wait a little bit, but the outcome is the most important part.
Thanks, Evan. I'm going to take the liberty of the next question in answering it. So the question is, what if you cannot leave the house due to a disability and need a test? What services are available? So the services are available in Ballarat, and we have an incredible program at Ballarat Health Services, the BHS at Home program. So I will ask that we put the phone number into the chat. It will be a general number. If you request that, we will, as a matter of priority, get a team out to you of highly skilled medical professionals to undertake a test. And we know it's incredibly important that we provide accessibility for people that actually require it and can't get to our testing site. So very, very much thank you for that question, a great question. Jeroen, I think this is one for you. So when will you have confidence that the outbreak is being ring-fenced in Ballarat?
Well, that's a great question, Melanie. So luckily it's actually one for the public health team and the chief health officer to make that decision, not someone like me. But the way we'd expect to see this, so it is about obviously the number of cases we find is really important. So if we're finding lots of cases over the next few days, that's not a great place to be. We'd be pretty concerned about that. If we're finding lots of unlinked cases, we'd be worried about that. So cases that don't have obvious connections to each other, so we don't yet know where those acquisitions are. And finally, it's around, obviously the number of people getting forward to get tested. The more tests you have, the more confident you are, you get a good picture. My expectation, based on what we're seeing at the moment, is that, really by Monday, Tuesday, we should have a pretty good picture then of 4 or 5 days of really heavy testing. If we're doing 2,500 tests a day, we should be getting to the 10,000 test mark, 12,000 test mark. That will give us, I think, a pretty good sense of coverage. If all those primary close contacts have been tested, that helps us out. if we're not seeing any more strange wastewater detects or poopings, as some would call them on the comment box, then we'll work. Then that will give us a bit of confidence. And if the people who are isolating well, so those are all things that will give us more confidence. And I'd like to think, and I think Rose is pretty on the same page as me. Really, by Monday, Tuesday, we should have a pretty good view about what's starting to happen and be able to give some good advice to people about that.
I'm going to give the next one to Rosemary then. So will we come out of lockdown, Rosemary, if there are still viral traces in the sewage wastewater?
Well, as Jeroen has just said, that's actually a decision for the Chief Health Officer in terms of providing the advice to that decision. And so, as Jeroen has said, it's not just about wastewater, it's about the distribution, the spread of that wastewater and those detections. It's about the other information we have. Can I reiterate that our contact tracing and our confidence is only as good as the people who have come out for testing. And it's entirely possible that we see sometimes that there's great testing, but somehow these things still emerge, even though we've had great testing. It's because the people we really need to come out aren't necessarily getting tested. So that's why we're very keen to see a proportion of the population. And remember, in a city of 100,000 people, 1,000 is 1% of the population. So to think that we've already got about 5% of the population tested already is just a magnificent achievement on the part of the citizens of Ballarat. But of course, we who live here would expect nothing less, because that's because we know the sort of city that Ballarat is and the people who live here. And really, it's all about the people who make it what it is. So in summary, essentially, that decision is informed by numbers of bits of evidence, as Jeroen has spoken about, and clearly that's the decision for the Chief Health Officer to provide the advice about what should happen.
Rosemary, another medical question for you. How do I know my symptoms aren't just hay fever? And we had a delightful spring day today with the wind roaring through. So no doubt hay fever's out and about.
Yeah, great question. It could have been hay fever day, couldn't it, when it was so windy and it's early spring. So that's what we know, that as the grasses start coming from the west, that's exactly what happens. But hay fever does share some of the symptoms of COVID. As we know, runny nose, itchy eyes isn't necessarily COVID, but we can easily put it down to that or not. Sore throat, often a scratchy throat. And our recommendation is that if a person usually gets hay fever and they have their hay fever medications, we ask them to use their hay fever medications. But if their hay fever medications don't relieve their symptoms within about an hour, then we ask them to seek testing, because it could be COVID.
Thanks, Rosemary. Back to Jeroen for this one. And this is obviously a really strong topic at the moment, but can construction workers that live in Ballarat work outside of Ballarat at the moment, but not work in Melbourne? So that's, can construction workers that live in Ballarat work outside of Ballarat, excluding Melbourne?
So at this point in time, Ballarat, yes, construction workers, because essential workers, let me broaden the question slightly, Mel. Anybody who's an essential worker, and construction under the restrictions is still regarded as an essential service, and there are separate restrictions on construction in terms of the number of people you can have on site and the way that sites are set up, and there's a whole series of COVID safe protocols they have to comply with. But if you're working under those directions, yes, construction workers who live in Ballarat can travel outside of Ballarat for their work and travel back in again. What we have closed down a couple of days ago is there are no construction workers living in Melbourne cannot work regionally, and construction workers who live in the regions cannot work in Melbourne at this point in time, given the high level of community transmission we're seeing in Melbourne.
Thanks, Jeroen. I think it's certainly a topic I know that's very, very strong on social media, so great to clarify that. Another one for Rosemary. If I use a QR code, can I assume that I will be contacted by DHHS and need to get tested, or do I need to check the exposure site list?
And the answer is yes to both. So we do expect that a person, especially for a tier 2, will get a text message. And so, however, if you're using, and this is one of the great advantages actually of using the QR code, is that it is linked to getting a message if that site where you've been happens to become a tier 2 site in particular. So please use the QR codes wherever you go. The second thing is that we still are asking any resident to keep on looking at those exposure sites, because for some reason there might be a time lag between when we can actually be organising all the information to have the QR code to have the text messages sent out. So it's really now becoming very important for our community members to be partnering with all of the agencies and with the public health unit in looking after ourselves in as much. So I don't think we can necessarily only expect to be told what to do, but in terms we're certainly asking our community to take the initiative, keep themselves informed of the exposure sites, follow the advice on the exposure site, follow the advice in a text message when you get one. The reason I differentiated there between tier 1 and tier 2 is that in a city our size with tier 1 sites, for the most part, we know who's been at the tier 1. As Jeroen was saying earlier, it's usually around the risk of an exposure. So therefore, if we've asked our case about where they've been, we're usually able to, through a number of different mechanisms, identify who has been around them at the time so that we can be contacting those people directly in any case.
Thanks, Rosemary. I'm going to get the first person to jump in with this one, but are there any professionals who are experienced to support autistic people during testing? I don't know whether that was one for you, Rosemary, or Jeroen.
I'm happy to give it a shot. I'm not a clinician, so I can't provide a huge amount of depth on this one. But certainly there are. We know that we've dealt with a number of specialists, and I'm thinking more of the Melbourne experience. Both are dealing with very young children, where we provide specialist services for young children, but also for people with disabilities who have particular concerns around testing, including those who may suffer from autism. So I would suggest that if you speak to your normal counsellor, to your normal support person, or your normal medical advisor who's helping you with your autistic family member, and get their best advice. Again, I think this is often where we tend to use the more specialist testing facilities to provide that. We will also then make an assessment with you about the relative risk, the risk of exposure that individual has had. So if you have an autistic family member at home, and you're generally concerned, it may be easier to test members of the family and to isolate the family for a few days and just see how we go there. So I would suggest that you reach out in those kind of ways.
Wonderful. I think that's a wonderful response. And I am going to add a little bit about that, because I do want to talk also about don't delay any healthcare at the moment. Our hospitals, we have staff in incredible PPE to both protect themselves but protect our community. And we just need people to continue their healthcare, whether it's in a hospital environment, whether it's with their local GP, through their local pharmacy. There are a number of ways in which healthcare can continue during this period, and I certainly urge everyone to do so. Rosemary, can I walk in for a Pfizer vaccine?
I think so, but I'm afraid I have to take that on notice. I'm actually in the zone of testing and contact tracing at the moment, so I haven't got that information to the top of my head, I'm afraid, but we will provide that information on the Ballarat Health Services website. I think it's actually already on the Ballarat Health Services website. It does depend on a person and their age group, to my understanding, but I think it's I know that as we're getting more doses and increasing more opportunities for people to get vaccinated, that is in the transition of changing. So I don't want to say something today that's not the case tomorrow or over the weekend or next week. So let's check the website.
We'll ensure we get that information on our website, and we'll clarify that. But I certainly know that AZ is available for walk-ins, and particularly for those construction workers at the moment, we absolutely ask you to take some time out of your busy schedule and walk in on up for those AZ if you fall within that age group. That would be absolutely wonderful. Next question, I think, is also back to you, Rosemary. Is there anywhere in Ballarat for people to quarantine if they're unable to quarantine at home, such as a hotel quarantine-like facility?
That's a great question, and certainly something that has been occupying the good citizens and the good employees of the City of Ballarat today, and others, and indeed very much working in partnership. It is the case that when we're doing our contact tracing, especially when we're looking at people who are contacts of cases, that we do sometimes have people who can't safely quarantine away from others in their household, or for whatever reason need to be separated. And so For people who we know in that situation, then we do try and find a suitable accommodation. To my knowledge, City of Ballarat would be fielding any other phone calls. So I might kick over to you, Evan, to finesse that answer.
Yeah, look, thanks, Rosemary, for that. And it is certainly something that we're having a range of conversations at the moment, and it is really important for those that need to isolate, that they can isolate in a safe environment. And we understand there are many people out there that live in a range of different circumstances that are quite often unsafe. And the last thing we want to do is have people having to isolate in an unsafe environment. What I would recommend, if you don't have a safe place to isolate, I recommend you ring the COVID hotline, so 1800 675 398, and then that will be triaged through council, and we'll be able to find a suitable location for a person to quarantine.
Thanks, Evan. I think that's wonderful advice. And as I said, we're not just providing healthcare at the moment. We're providing as much support we can in a social setting and an economic setting, and we'll continue to do so. Because I can't get into trouble as a facilitator and chair, I am going to throw to Dr. Aaron for this question. And Aaron is one of our incredibly talented, we say an ID physician, but it's infectious disease doctor essentially. But so Aaron, I'm feeling a bit sick. I'm a close contact, but I've actually got a medical condition I need to take care, whether I'm having chemotherapy or something else that I need to present. What's your advice? What do I do?
Thanks for the question, Melanie, and for having me on. As you said before, I think it's really important to emphasise that we continue to provide healthcare to our community through the COVID outbreak. But what's really important is that we do it safely. And in order to do so, we need to know in advance if you are a close contact, because we've got a whole lot of procedures that we've been working on furiously for the past 18 months to ensure that we can bring you into the hospital safely and ensure that no one is potentially exposed to COVID along the way, and we don't have to isolate further members of the community or indeed members of our healthcare service. So all you need to do is be in touch with us at the hospital or at the Grampians Public Health Unit so we can make those appropriate arrangements, and we can do everything we can to provide your healthcare and keep the community safe at the same time. Thanks.
Excellent. You certainly know he's our go-to person for anything in relation to COVID or infectious diseases. I promise you we're in absolutely safe hands there. I've just got some information in, and thank you for that information. I just want to confirm at the moment, and we will continue to put it up, that there are no walk-in for Pfizer at the moment. And as you know, that information changes quite regularly, but certainly AstraZeneca, we do have walk-ins for, and we absolutely urge people to come forward for that dose if you're eligible in that age bracket. I will ask Rosemary, and one of the things that, in terms of transparency and information to our community, it's incredibly important that we provide information. I just want to talk to her a little bit about what's going on in our community at the moment and the level of care that's provided to those people in isolation or are COVID positive. But before I throw to her to say, what support is given, I also want to talk about a little bit quickly about what's happening in the hospital and just inform our community that the Ballarat Health Service is no longer caring for any COVID positive patients at the base hospital at the moment. But we do continue to support people in the community. And one way, as I said, is through our BHS at Home program, in which we have incredibly skilled clinicians provide that support in the home. But from a Grampians public health point of view, Rosemary, what kind of support, if you find yourself COVID positive, would you expect from the Grampians Public Health Unit?
Well, the Grampians Public Health Unit's role is to ensure that we're doing the public health actions. And as I said at the top of that list of case, care, contain, contact and communication, the care is a very important part. And so what we do in that situation is we make sure that we refer a person for care to either their usual treating team, or if they need particular levels of care, to other experts in our community who can do that. And I know that we've had meetings today because we have partners in that care in our community. Obviously, we have not only the health services employees and the experts in the health services, and by health services, I mean Ballarat Health Services and St John of God, who as you've heard us say before, are working as if we're one organisation to together serve the one community. But also, of course, our very important primary care partners, so general practitioners in our community as well. And so there are referral pathways to the appropriate level of care, and then the primary care teams and the health service are working together to ensure that a person has a wrap of care around them as they need it.
Thanks, Rosemary. I've come to the end of the list of questions so far. There's no doubt there'll be some questions that continually come through Facebook. Whoops, no, we've got one more. Pregnancy and vaccinations. Are pregnant women a priority group? That sounds a very medical question, either for Aaron or Rosemary. I'm going to ask Aaron for that one.
Thanks for that, Mel. Absolutely. So pregnant women have been made a priority group, and that was announced, I think it was last week. Time really blurs at the moment. And that's in recognition of the fact that millions of women around the world have been vaccinated safely with the Pfizer vaccine. So it's incredibly safe. It's incredibly effective. And we've seen that unvaccinated women can unfortunately have some significant adverse outcomes in terms of preterm labour, and you know, they can become quite sick. And I think it's also a good opportunity, if you don't mind, to say how important it is for us all in this community to take this opportunity to now get vaccinated. We're very lucky to get those extra 10,000 doses. You can make your appointment now. We know you can walk in for AstraZeneca as well. These vaccines are incredibly safe. They're incredibly effective. We never thought we'd get such safe and effective vaccines. And if we look forward as we come out of this outbreak, we don't just need to think about the percentage rate of vaccination across our community. We need to think that every time we have a risk, each one of us, if we're vaccinated, lowers the risk of us going back into lockdown, lowers the risk of us having another outbreak, and allows us to get back to that normal life. So it's up to us as a team here at Ballarat, every one of us. We know someone who hasn't been vaccinated, convince them. We haven't had the time, go get vaccinated. That's how we get out of this as quickly as possible and get back to our normal lives.
Thanks, Aaron. And I'll throw to you then, because I've got another vaccination question come through. So have any of the local COVID positive cases been vaccinated?
I don't have that 100% to hand. I don't believe so, but I don't want to tell you something that's not 100% true. But certainly if we look across this outbreak, as we sort of hear from Jeroen and the team each day, we know that the overwhelming majority of our cases haven't been vaccinated. We know there are a whole range of reasons for that, whether they're younger people, whether they don't have the time or the access to a vaccination. But we know that if you're vaccinated, you're protected. We're not seeing vaccinated people getting infected or getting sick predominantly.
Thanks, Aaron. An important question's just come through. It's been numerous times, but are there toilets available at testing sites with such long wait times? What do we do? I'm going to send that one to Evan.
Thanks, Mel, for that one. And we certainly have a row of portable toilets at each testing site, obviously depending on the location where they are, but there is certainly toilets there. So we understand people are having to spend some time in the queues, so we need to make sure that we've got the facilities there to make it as comfortable as possible.
Excellent. Jeroen, just so you're not missing out, is there a risk of exposure outside the dates and times listed for a particular site? So if I've gone to Big W 10 minutes afterwards or to Bunnings, is there a risk to me?
Look, I think, Mel, on balance, we'd say no. So when our contact tracers talk to the positive case, we'll ask them, where were you, what were your movements? And then we'll also ask them to validate, or say, have you got a receipt? Have you got any information on your phone about where you might have been? So we'll use as much information as we can to validate exactly that the timing that people remember is as clear and as accurate as possible. And sometimes, for particularly sensitive cases, we might even go to look at CCTV in stores and those sort of things to really get a good sense of the movements in those complex places, so we can narrow down the window to as much as reasonably possible. But equally, we'll also add a little bit of fat onto the side to make sure, let's make sure that if someone was a bit slower going in, then we might reasonably think let's provide a little bit of leeway. So that's a judgment call that we make. So we would say, if you've been somewhere in an exposure site in that time window, please get tested if it's a tier 1 or tier 2 site and isolate as appropriate. If you're outside that window, then please don't worry. And particularly, a word for the retailers. It is so traumatic, particularly for small retailers, to have to be listed on that site. It's not something nobody wants to know that positive cases have been there. 99 times out of 100, the retailers have done nothing wrong. They've got all their COVID safe plans. It just happens to be that somebody who was positive came into their store, unwittingly. When we work with the retailers really closely, particularly through Rosemary's team, they'll do the deep clean, they'll provide all the information they need, and then they're back in business again, and then they're good to go. So please don't start avoiding places because 3 weeks ago they had a COVID positive case. We clean them so we can all move on, and please continue to support those who are impacted by the pandemic.
I think that's great, and I think that just goes back to at this time of great stress in our community, certainly being kind to those sites as well. It's critically important. To Rosemary, once the backlog from symptomatic testing and exposure site testing is passed, would you recommend asymptomatic testing just to check if there's no unidentified spread?
Look, I think the secret to that is that as many people, we want people to get tested. And the more people who get tested, the more information we have. So what we have sometimes had in the past is asymptomatic testing, and for some reason the following day a person gets a symptom. So importantly, we want people to be reflecting on even the slightest of symptom, we want them to come out and get testing. Certainly in a situation like this, asymptomatic testing has a place. And I understand, I might actually throw back to Jeroen to tell us the story about what happened in Shepparton around testing, to be able to give confidence around the level of testing and what that meant for the Shepparton outbreak.
Yeah, thanks, Rosemary. Nice to pass back. Absolutely, Shepparton again was a fantastic example around the scale of testing we saw over a very short period of time, and a lot of the lessons that when Evan and I were standing in Victoria Park yesterday morning, I think we saw that whole mobile testing station being set up in record time was all based on experience that we had in Shepparton and other places. So we saw a really great testing result come back in again. But what we found in Shepparton was literally tens of cases in the early days. We found a lot of cases that had already been, I think, rumbling in the community for a while. Despite the fact that I think at the end in Shepparton, we had 142 active cases in the entirety of the outbreak, we still ran it to ground over about a 4-week period. So I hope we don't get anything like that number of cases in Ballarat. I'd love to keep it in single figures. That'd be a fantastic result. But even if you find more numbers, providing people isolate and do the right thing, and providing we do it all together, it will absolutely, we can absolutely get this under control between us.
Wonderful. So just on that question, and I'll let Evan or Mayor Moloney answer this one, but workers taking time off for testing and quarantine, we know that we've talked about how incredibly important it is, but what compensation's available by the government for this?
Yeah, look, I'll have a go at the first part of that, Mel. Obviously, as a council ourselves, we're providing leave for anyone who wants to go and get tested, and that's really important that we lead by example. We also have a fairly significant community-facing component to our organisation, and we need to make sure our organisation and the community is kept safe. I do understand that there is state government support for those that are isolating. There is financial support out there for people isolating. So once again, I recommend going through the Ballarat Health Services site to the whole range of Victorian government sites that will provide you insights into what support is available out there financially.
Thanks, Evan. And I'm just very aware of time. And one of the other questions we've had is, can Ballarat deal with the surge if we do get a surge in cases? And I absolutely say to you very confidently, yes, we can. We have an incredible workforce here. We have an incredible team behind us, and we have planned for this. We know that we can deal with it, and we will deal with it. So I suppose be rest assured and be very confident that the support services at Ballarat will allow for us to adequately cope with a surge. But also, it's not just Ballarat that needs to cope with a surge. What we've seen is the incredible work provided by the state in recent days, and we are part of a network of health service providers. We're certainly not in this alone, and I can't reiterate enough of the support that's been provided to Ballarat. We know, look, I thank you so very, very much for your questions. I thank the presenters here tonight. There's been an incredibly long week. There's been many, many hours of work going in this week. So No, I know everyone's probably a little bit weary, as you are in the community as well. We want to get back to normality as quickly as we possibly can, and every effort that you make to get that test or to get vaccinated is one step closer to us achieving that wonderful outcome, both in Ballarat but also Victoria. So thank you so very, very much. There's some questions that are still coming through. We will get to them. We will provide information, but I just thank once again everyone for coming online and being part of this enormous community effort. Thank you.